Who here has before y'all talk to me? Have you heard of using ultrasound before to deliver drugs?
What's up, guys? Welcome back to the Startup Storybook podcast. My name is Turner Ray here with Wes Hoare, and this is the first episode we're going to do in a series with Nucleate, Texas. So today here we have Manny and Paulomi with us. Nucleate, Texas is a global organization of entrepreneurs, and to introduce herself, her role, and what Nucleate, Texas is, here's Paulomi. Paulomi, welcome. Why don't you just tell us a little bit about yourself and what Nucleate is?
Absolutely. I'm Paulomi. I'm a fifth-year graduate student at UT Health in San Antonio. I'm currently pursuing my PhD, doing a dissertation on rare pediatric muscle cancer. So, what is Nucleate? We are a global nonprofit organization. We focus on democratizing resources and education for life science trainees all across the world. And as to my role within Nucleate, I'm the regional director for the Texas chapter, and I oversee operations in four major cities: Houston, Austin, Dallas, and San Antonio. And thank you so much for that warm welcome. I'm really excited to be here.
Yeah, no, thank you so much, Paulomi. So can you introduce us to Manny now?
Yeah, absolutely. So I'm really excited to have Manny and co-host this with you guys and interview him for your amazing podcast. So, uh, ladies and gentlemen, biotech believers and startup strugglers, welcome to the very first collaboration between Nucleate Texas and Startup Storybook. This union is so powerful, we had to summon a Nucleate and a startup royalty. It is my profound honor, my obligation, and just a slight fear to introduce you to one of my favorite human beings on this planet, and definitely one of my favorite startup founders. Born in the legendary land of Lebanon, educated in the mysterious halls of ACC, and rising to his glory at Rice University, he now reigns supreme in the noble realm of ultrasound-based drug delivery. He is the lord of loopholes, master of memes, annoyer in chief, and His Highness the King of Good Wives. He is also the founding father of Nucleate Texas, a crown jewel of his chaotic biotech energy. A man so loyal to his startup and the cause that he bleeds pitch decks and dreams in FDA approval timelines. Please welcome to the one, the only, the highness of high frequency cell membrane penetration himself, the Manny of MUSIQ Bio.
Thank you so much. That was amazing. for for those of you just listening to that amazing intro, this is payback because I had given her like a UFC style introduction at a large live event, and I surprised her with that. So this is payback. But yes, thank you very much for that intro, Palomi. Um, just to reiterate on myself, I am the CEO of MUSIQ Bio, where we're using ultrasound to improve drug delivery to treat different kinds of cancers and neurodegenerative diseases. We'll get into that more throughout the podcast. But I'm just still like living that introduction. Thank you so much, Paulomi.
No,
You're welcome.
that was great, Paulomi. Manny, thank you for coming on. So, your company, we'll get into that and all of the amazing things that you're doing. Why don't you give us just kind of a quick background on where you're from and how you got to where you are now?
Yeah. So, as she said in her introduction, really, I've been, raised throughout my life, in mountains of Lebanon, actually. So that my background was literally in this village up in the mountains of Lebanon, and from there, I got really interested in wanting to help people in human health. So really, I was also a pretty smart kid. So if you're a smart kid over there in the mountains, you only got three options: you either go and become a lawyer, a doctor, or you go join the military just for the benefits. But for me, I wanted to help people, so doctor route. But then in like final year of high school, I ended up watching a movie called G.I. Joe: Rise of Cobra, and that got me into nanotechnology for the first time. And it's very unique because usually in Lebanon back then, electricity would come on every 4 hours. So it means that whenever electricity was on, I got to watch a movie. I watched that movie. It happened to be on TV. Um, and I got hooked on it. And I started Googling, different universities. And the first one that popped up was actually Rice University, which I got my PhD from actually last month. But that was back when I was like 18 years old. And so it was literally like a crazy moment in time. But that's kind of like the short background. I'm happy to go down like deeps uh, from when I finished high school and went came to America to how I got to where I'm at right now.
Yeah,
Mhm.
that's such a great segue to my first question to you, which is let's start with that move. Like coming from the Lebanon to the US, that's such a huge shift. So what was that transition like for you, like culturally and personally? And like I moved from India to the States, and there was a moment in my life where it was like, this isn't home anymore. Like, and I have to build something from scratch here. What was that like for you?
Yeah, so I mean, coming over here, I think first steps first is I came to Austin, Texas. We had some family over here, like some distant relatives from our village back home in Lebanon were living here as well. And we had my dad's cousin who I treat him as an uncle. He came and helped me set up initially here. Got set up in an apartment. But as you get started, everything is just go 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 here. This is just the land of opportunities, and there's even places to start early on. So I didn't apply for college at the time, but we did learn about this opportunity at Austin Community College where you just go in, walk in, and you sign up, and you can register for classes the next day. Um, and so that was my story is that within the first week, I got my driver's license by sitting in a gas station computer screen for 6 hours, getting my driver's license, doing the driver's test, and then got signed up for Austin Community College. And then about like a month later, I decided I need money, which is funny because I was always thinking about that. So I actually got my first job cleaning bowling shoes at a Main Event Entertainment at the time. So that's really how I got started. Is you just get to work and you get to studying because you're in this place here and there's no time to waste.
Mhm. Now, I really want to know more about your time at Rice, but I wanna focus on some of this early story, that you have here. And so, I mean, it's not every day that I get to talk to someone that grew up in a different nation, let alone halfway across the world. So, can you tell me, like, tell me more about the cultural shift and, like, um what's something that I wouldn't expect, from your time in Lebanon? Like, what's something like that?
Oh, I could tell you immediately, like, just again, how people are, coming over here. Like, you see these opportunities back home in Lebanon. There's opportunities are few and far in between. The infrastructure was really not set up really well. Resources were pretty low. I told you right now, electricity used to cut off every 4 hours. It got worse actually after I left. We actually left at like we got lucky that I left at that time. Because it got worse and worse. It started coming on only 1 hour a day. So water used to, and this is probably the biggest shift that I have. Learning how amazing pressurized water is. So let me give you an example in plumbing system. Like you go to Lebanon, a village, your water system is literally coming out of a hose. It's being powered by gravity. So that means that your water is only going to come out of a hose. It's going to come out at the speed of gravity, and so it's not pressurized. I come here to the States. I turn on the faucet. Oh, wow, this is like a high turn on, the shower head. Oh my god, this is so much pressurized water. Changes your life completely. So that's a big like shift that I noticed. I think in terms of the people back home in Lebanon, like literally you'd go out anywhere, you were comfortable literally walking around. Kids would be running around because the village takes care of you. And so you had everybody, not just in my village, but all the surrounding villages around me. They knew each other. They knew each other so much that they become like my parents' personal spy network. My parents didn't need to know where I was because they know that everyone else would let them know where I was. Uh, and there's some funny stories about that, about being at a cafe and deciding to order like a beer at like 15 years old. The waiter took my order, brings it, and before it like settles, I get a phone call from my dad. Keep in mind that this cafe is like 5 villages away. He calls me and said, "Why are you drinking beer?" And I'm looking around like, is he around me? And like, no, because the guy snitched at me because him and my dad are like best friends. So that's just how it was mentality then. Come over here to the States, you really think of like you're alone. Like, especially when as an immigrant coming in over here, you're really alone. You're trying to, and only thing that you can think about is career and education. So it's kind of like that mentality shift. And culture shift is really just super career driven, education driven, professional development driven. Uh, Literally, that's all I could think of. And that's the same kind of mindset adopted by every other person who comes in from Lebanon. All my buddies, literally, they say they come here. It's just either, focus on getting money, focus on getting education, on building their careers. So that's, I think, more from that mentality mindset that changed.
I think you said it a second ago, but I forgive me, I can't remember. When exactly did you come to the United States?
2014. I remember the date, October 6th, 2014.
Wow.
When I get oh, yeah, no, I remember that day.
Mhm. Yeah. Mm.
I know we're
Right.
talking a lot about the differences between Lebanon and the States, but there has to be like a value or habit or like something that you learned in your childhood and the way that you grew up that's stuck with you that you apply to this day to your current job as the CEO of MUSIQ Bio.
Oh, yeah, it's to make use of what minimal resources you got. So, I think a little special thing about me is that back home in Lebanon, like I said, you don't have that much internet. Your Wi-Fi is also the slowest Wi-Fi on earth. So, you had to really read a lot, utilize, for example, books from the library. Um, I remember, like, trying to learn Arabic at the time. I was using, like, translational dictionary books from, like, the 1950s that my aunt had stored away, gathering dust with even some stains from her herbal tea. So, like, I had to learn and utilize not only those, but also my parents' own, like, language, the knowledge of the language, to be able to learn the language in real time, um, and be able to do well on whether it's exams or other stuff. I think another thing that helped me and it made me much more prepared is that over there it's under the French education system. So we would be learning like college level courses or math courses in high school. We're talking like calculus 2 and 3 and like differential equations. I was learning differential equations in 12th grade, for example. So yeah, so it's like a very intense, like, everything that you'd see in college level math or physics or chemistry, like or OChem, like that was all done in high school. But that's because it offset the fact that we had lack of resources that I didn't even get to work with a beaker until I went to college here. I went to community college. So I never touched a beaker or saw a beaker or really any lab equipment because it's just like there's just not that much resources that you'd find in that country versus here in the United States. So that was the main difference is that they focus a lot on the theory, and that helped prepare me for the classwork I got here. But then the actual application and experimentation, because of the resources here, I got to actually learn and fiddle around with them. So that actually does. We'll talk about it later, but like how it really pushed me to finding a lab when I then transferred out of ACC to go to UT Austin. And we can get into that in a bit.
No, let's talk about ACC now that you've mentioned it. Like, you and I, Manny, have been very lucky to know a lot of different types of grad students from all different kind of walks of life. So, like, you're talking about making a very strategic and financial decision as somebody who's just moved to the States to go to a community college at first. So, what would you like give advice to people who are trying to get a crack at higher education, like, and sort of figuring out that over glamorized sort of big name schools versus doing something that's more strategic and something that's more slow paced to help themselves get that leg up.
Oh yeah, no, there's like even at the time, there's always like this stigma about, community college students, instead of going to like a big name school. But what I found it was that some of the teachers that were at ACC were also teaching at Texas A&M and UT Austin and all these other 4-year universities. So I'm like, well, why do I have to pay? At the time, it was like $5,000 to $6,000 per semester when I could be paying $1,000 per semester for similar courses, and it's just that financially made sense for me. Plus, a lot of things about Texas that I really like, um, and about education here is that there's opportunities for scholarships, for these grants, and they did help out financially for me. So that made more sense to start off in the community college, get most of the coursework out. So then when I do eventually transfer, I don't have to stay longer in 4-year university and pay more money. Plus, it helps boost my grades up, allows me to be eligible for scholarships. So that when I went to community college, I got like a 4.0 GPA, like aced everything, mainly because they didn't count my high school classes as college level classes, so I had to retake them. So it was basically like I had like it was cheating at that point, but it's that's how they structured their system here. That they don't value they don't count the high school level courses. So even though I told them that, but that just meant that I was getting free education at that point. Like I went to community college, I was getting paid to go to community college, based on the number of sponsorship scholarships and grants that I was getting. So it was a real good opportunity. It allowed me to also work for 2 years, um, and get a job, not just with cleaning bowling shoes, but then it eventually helped me get my next job, which was teaching for the Princeton Review. I was teaching MCAT level biology uh, to pre med students for the Princeton Review. I think I was 19 years old at the time. They were doing like a hiring thing, and I had put advertisement, and I went through their very strict onboarding, uh, and just basically I did the same thing that you did in Lebanon. I'd go to the library, picked up all of the books that you teach biology, and I learned all of biology in like 8 days or something. Um, Keep in mind that I only knew like 20% of the material at the time, but I just learned all of like medical biology in like in like a little bit over a week, and then was teaching it like 2 months later. So that was a much better job than cleaning bowling shoes. I'll tell you that for sure.
Absolutely. And the great thing about that job is you're learning and getting around the environment that you want to be in, right? Like teaching biology, work prints and review, these are all very academic, high level, important things in the world of bioscience. And your role, I mean, I'm certain was not the most prestigious thing. However, it's getting your foot in the door and starting the process. I think one of the things that um, college students can kind of get into the rut of is, oh, I'm gonna go back to my summer job working at Dairy Queen. It's too hard to find an internship. Like you're making money, which is important and necessary, but you're not really getting the personal, professional, perhaps even spiritual growth that you get working somewhere that is going to be advancing you in the future. And so, one thing I'm already picking up in your story is you had the drive, whether that's from being an immigrant and having to see that you or have to put in the work, putting in the work because the school system in Lebanon is potentially more difficult, sounds like, certainly. Or just that's your own personal interests. And I want to kind of keep hearing this story. So Austin Community College, and then you went to UT and Rice. So kind of walk us through those next couple steps.
Gotcha. So yeah, so I was at community college, and then I applied for transfer to UT Austin. After 2 years at ACC, got into their biomedical engineering bachelor's degree program at UT Austin. Um, Considering like it was like a class of like 120 people at the time, 100, Uh, among the transfer students that year for that cohort, I think they accepted like roughly around 5 to 7. So you're talking like actually like a very very strict and very high chances of Oh, it's not as it's very strict, yeah, in terms of, like, who gets admitted, who doesn't. So I made it through, so that was pretty great, pretty nice. Um, but, yeah, I got into UT Austin's biomedical engineering program. I think what they did was they've worked with community college students before and transfer students, so they're able to, like, truncate my years that I need to go through the program. Of course, there's, like, prerequisite courses and whatnot, but the only courses that I had to do that were not biomedical engineering courses was, like, a biochemistry course and an engineering communication course, if I remember. And that's really it. Everything else was, like, fully on my major, like, written on it BME course. Um, when I got into UT Austin, I think I spent that first year, as I was working as a biology instructor, and then going through the classes and just seeing how they are. Of course, breezing through them. I decided that hey, I needed to get into research. If I was going to become and go do my PhD, do a PhD, I need to start getting some research experience. That was really what my initial dream was when I saw that GI Joe movie. Is I want to be able to take stuff from the research side, this cool stuff, because it just looked cool, but turn it out into a real life product that can do this cool stuff on people, right? And so that's my like literally at 18 years old, I knew I want to do a PhD, but I need to get there. I had to meet all these milestones. And so yeah, UT Austin, go and join the lab. I emailed a few labs. There's one that accepted me. It was a spinal cord regeneration lab at the time. Uh, Dr. Shelly Sakiyama Elbert's lab. She's right now at I believe at University of Washington, if I'm not mistaken. Her lab moved from UT Austin, but I was in there and I worked with like an amazing grad student mentor. I was basically living in lab. I love being in lab. It was like my dream come true coming in to be in the lab. So I was in the lab when I wasn't in class, I was just going to lab. So really, if I was basically a researcher who's just taking classes for fun at that point. Like that was really it. But no, it was a real great experience because I got to learn a lot and really, and also, and we can get into it more, but like also the mentality shift coming in as a community college transfer student into a 4 year university versus coming in as a freshman. So two different mentalities, two different experiences. All right. When I came in, a lot of my class that at UT Austin had been together since freshman year.
Mm.
So I was as a new kid on the block and trying to get integrated with their group. But I felt more comfortable getting integrated with the graduate students in my lab in general because I was spending so much time in lab and having so much fun and getting things done that I was just staying in there and working a lot. So yeah, I think that's kind of like my step into research. Did a lot of work there, applied to grad schools all over the country, and of course with Rice being one of my top ones. Um, and through my research experience at UT Austin, published 2 papers, second author with my grad student. And yeah, then among the grad schools, I was applying like for. I remember I was applying for 10 at the time, got into three, um, and one of them being Rice, because which is one was my top choice, and I ended up with a no brainer to go to Rice. Huh?
Yeah. I mean, I'm curious because, oh, I mean, I'm an undergrad, and to be honest, I don't think I'm going to be going to grad school, but I'm still curious nonetheless. What goes into evaluating different grad schools, and well, what made you land at Rice? You said it was an obvious pick to you, so what made it so obvious?
Well, that's a great question. For me, it was more about, fulfilling a dream that I had when I was like in high school of like, going to work in on the nanotech side,
Hmm.
bio nano side. I think also just reading more about Houston and the Texas Medical Center and how that was a growing center for biotech research, and clinical stage research. It felt like it wasn't as established as you would see in a Boston or Bay Area,
Mm,
but the thing is, it's the infrastructure is there and it's
mhm,
ready to explode. So my initial thought process is, how do I get into this Texas biotech ecosystem here and build myself up so that, 10, 15, 20 years from now, I'm growing with this exploding ecosystem.
Hmm.
So instead of going to an already established spot, why don't we going into a spot that's ready and ripe to explode in the next few decades and being a part of that growth felt like more of an enticing thing for me. And this is me thinking it like, at like when I was applying for my PhD at the time. So I was a very like ambitious thinker, thinking like on like how can I see my future here, and that's one of the biggest reasons. Also, it's close to family at the time. My family. So when I came to Austin, my family then followed like about 6 months later, and we lived in this apartment for like 10 years, until we got a house. But uh, at the time, my family were living in Austin, so it makes it easier to visit and check in on my family if I'm in Houston. So there was that. Financials. I mean, I applied to schools in like the Northeast and the West Coast, and no matter where I applied, it made the most sense financially to stay in Texas and in Houston because it was cheaper, cost of living, and the stipends were very similar to what I was getting anyway. So I'd either take like $30,000 and live in Houston really well, or I'd take $30,000 and live in a box in California. So like I think the option was pretty good.
just for the listeners who are not familiar with the PhD programs, pretty much all PhD programs in the biology biomedical field are like when you get in, there's an understanding that they're going to cover your tuition. So you don't owe tuition, you don't pay to go to school. And then you get an appointment as a graduate research assistant, which is essentially what gets you a stipend, very similarly to how med students get in their residency programs. So the stipend is actually decided on the cost of living of the area, right? So like within Houston, that could be variable as well. Like so my alma mater is University of Houston, which has a lower stipend as compared to Rice because while Rice is in the Rice Village, it costs more to live there, whereas U of H. So it's kind of all that goes into consideration of where you pick to go to school. And also, like Manny, you forgot about something biomedical engineering. Not a lot of grad students or grad programs out there for BMEs, specifically for what he wanted to do. And Rice is a really cool amalgamation of both biology and engineering.
A
Um,
and thank you for that, Paulomi. Actually, yes, bioengineering. So I was looking at the best bioengineering programs in the country as well, and Rice was definitely among them. I think another thing that goes into the, decision and the consideration is how many professors and labs would I be willing to work with at a university? There's a university out there that only has, like, 1 professor I wanna work with. I think I'd rank that pretty low versus a university that has like 6. Because if there's 6 professors I want to work with, that means I have more options once I'm in there to find a research lab that I'm going to enjoy or I'm going to pursue and be interested in. I think a lot of students, and I've heard this even at orientations for like grad school, I'd hear, oh, like this student says, like, yeah, I'm applying for this program just because of this one professor. And I'd be like, well, is there other programs that you have that have more than one professor? It's because like you're putting your eggs in one basket.
Mhm.
And there's so many reasons why that's not advisable, and we can get into them. But I would say like if you have more options, more professors to work with in a grad program, the much better you'll be at.
Yeah, again, for context, we rotate through these professors' labs, right? So, like, you get into a university, but the person who pays your check, like your stipend, isn't the university. It's your PI, like your principal investigator or your professor or your mentor, whatever you want to refer to them as. So, like, for what happens a lot of the times is like, like, I was really interested in working with zebrafish, and I only have one professor at this one university who does that kind of work. So that means that when I get into the program, I have to pick the professors from that program. And I might be stuck working with somebody that is not the best fit for me. So there's 2 layers of fit. One is the university itself, and then the other is the professor. And the professor is always gonna be like, you want to have a better fit with them than the university. So you might pick a university that's, like, overall a less ranking, but go with a professor you really wanna work with. So, and that's a great segue into my question for you about your dissertation, which, specific non-invasive delivery of retrograde viral vectors for the brain. Now imagine we're at a Thanksgiving table and nobody knows what any of these words mean. This might as well be Mercury's in retrograde. Like, what is happening? Tell us what it is that you did in your PhD and why is it important?
That's a great question. And I'll simplify it as this. I'm trying to get drug therapies into your brain without sticking a needle in there. I'm using ultrasound. And specifically how we're doing it is we're taking these viral vectors and we're actually changing them into our own little personal taxis. So we're taking viruses, engineering them and changing them into our own little personal taxis that can deliver what our therapies to the areas in the brain that we want to deliver them to, and we're using it in conjunction with ultrasound, where we can temporarily open specific regions of the brain, and then we can have our engineered taxi that's been injected into your arm go circulate and only go into that part of your brain. What we did was we engineered the viruses such that they don't go and be active or express or transduce in non-targeted areas. So, for example, I want that taxi to only deliver its cargo to just this to these brain cells only, but I don't want it to deliver or release or express that cargo in the liver or in the kidneys, right? So we engineer them so that they're more specific towards the brain and less specific towards your peripheral organs in your body. And so we use ultras. So really, we combine that with ultrasound, and we've improved again delivery to specific regions of the brain that govern different kinds of diseases, and that's why it's important. You're trying to improve delivery of these life-saving or promising therapeutics to specific areas of the brain, so that way you can um, treat different diseases that are very region specific, or even different circuits. So that last paper that we were talking about retrograde viral vectors. What a retrograde viral vector means is we have this virus. You deliver it to one area of the brain. Let's say in our case, we're delivering it to this, this deep brain area. But what happens is that this virus is special. This taxi is special. It can actually go into the neurons, these cells. It can go in through their terminal ends. So these neurons have these extensions. It can go in from the end of its extension, go up and go back to where it's originating, where the neuron was originating. So, for example, in our study, we delivered it deep into the brain, this virus, but we then found it being expressed on the surface of your brain at neurons there. And that's because the cells in your cortex at the surface of your brain are extending down into that deep brain area. And so that means that we can target this one area in the brain that's very deep, but we can get a specific expression and a specific treatment across a specific layer of cells on on the surface of your brain.
So it's almost like it's signaling. It's almost like you have a marker, like a signal that like lights up when you hit the taxi goes to the right destination.
Correct. Exactly, Mundo.
That's amazing. And so, obviously, this is research that you're loving and enjoying just from, I mean, obviously, you said in your undergrad, you were in the lab every day. So, is this the kind of research that transitions into music bio?
Yeah, so yes. So with MUSIQ Bio, again, we're using ultrasound in the same vein, but we're not really focusing in on turning the viruses into taxis. That was my PhD research. Instead, we're going to be focusing more on the ultrasound component. So I glossed over this, but I'm going to be more specific on how we actually temporarily open the blood brain barriers. Uh, it's not the ultrasound waves themselves. It's the response of this vehicle called a microbubble. So we actually inject these little bubbles, literally called microbubbles. They have a gas inside. They have a fatty shell. Well, you inject them intravenously. They'll circulate in the blood, and then when you pulse with ultrasound at the site, these bubbles actually expand and contract. And by expanding and contracting, they loosen the kind of tight junctions. Think of them as the locks on the blood-brain barrier, they loosen them, and it create these tiny openings that allow our drugs to enter into specific areas of the brain. But they'll only allow the drugs to enter in and not blood because we've made them safe. We've optimized the parameters such that they've only opened to allow our drugs to enter in, but not allow like blood cells to enter, so that way you don't get a hemorrhage. So that's why they've been proven safe and effective. So yes.
So, two questions. One, did this exist before you? And if not, well, then how did you invent it? Or if it did, what is your unique value and how did you take that technology and change it?
That's a great question. So the microbubbles, they've actually existed for like 30 years as imaging agents on their own. So they've been used for imaging. However, they're poor for drug delivery. All right. They're really terrible at drug delivery, mainly because if you're trying to inject them and you're injecting these microbubbles and they're going to just go everywhere in the body. And when you try to open the blood brain barrier, you open it, but you also have to co inject the drug or the therapy along with it. That drug will go everywhere in the body. It will go to your peripheral organs, it'll go to your brain, and it'll go to that opening. So what we're doing with our company is we're actually using research based out of UT Southwestern, University of Texas Southwestern Medical Center up in Dallas. My co-founder, Dr. Sina Korsendi, um, he is working out of Dr. Jacques Lux's lab, and he's developed these microbubbles, but he's taken them that were these imaging agents, and he's added these antibodies on their surface that can bind to specific cells in your body. So that means that you can now target specific cells, and he's also added a linker. So now you have the antibodies that can bind to specific areas in your body, and then a linker that can load whatever drug type or payload that you want. So we can load in these different kinds of drugs on it, and we can deliver them to the right cells due to the antibodies and linkers working together. We called it two-factor authentication for drug delivery.
Yeah.
Yeah, exactly. So two-factor authentication for drug delivery. When we inject these engineered microbubbles, we're calling MSQ. The antibody, they have their antibodies on their surface. They'll go in, circulate in your body, but then bind at the right cells in the body. But they won't release the drug that they're carrying. That's the fun part. They're not releasing the drug. They'll only release it with our second factor, the ultrasound. So then you pulse with the ultrasound only at that site, and the pulsing of the ultrasound causes the microbubbles to cavitate, expand, and contract, and then ultimately burst, temporarily opening the barrier. But at the same time, they're releasing the drug only at that site. So you get site specific delivery of the drug right then and there, and you minimize off target delivery to any other else in the body.
Manny, let's talk about applications here, like just so everyone can contextualize what is it that your technology could be used for, right? So let's say somebody has a tumor in their brain, right? So like first question here would be, can you explain to the audience why is it so hard to get drugs to that specific site of the tumor? And also, if you were able to get the drug in there, why is it like, how many people know chemotherapy is very toxic and like you lose your hair and all that stuff, but like, can you explain why that's a thing? And then also, like, how can potentially, like, your technology that you're talking about be used for something like that in the real world and that could help patients? Because that's your goal, right? It's at the end of
Yep.
the day, yeah.
And that's a great question, and that's a great segue because how my co-founder did is he used this technology for cancer immunotherapy, um, and he actually proved that out with two papers published using it in immunoresistant cancers. Immunoresistant cancers; these are cancers that don't respond well to what's the current clinical standard of care. So you're talking like drugs that are used in the clinic that are supposed to activate your immune system and allow your body to combat these tumors. They don't. Our technology and our platform is meant for patients that have immunoresistant versions of that, meaning that they don't respond well to immunotherapies. And so what we do is, especially in our proof of concept, we delivered it to this like very, I'm gonna call it very bad kind of triple negative of cancer. It's called metastatic triple negative breast cancer for PDL1 negative. It's a lot of jargon here.
It starts
Basically,
in the breast, ends up in your head. That
it can end up anywhere in your breath, in your head, in your lungs, anywhere.
Yeah.
It metastasized. So he did his study on these different mouse models that had this like metastasized cancer, and he showed an improvement compared to the current clinical standard of care, where he improved the rate of survival on these mice by like almost 80% compared to if you were to use the same drugs that are used in the clinic. By doing this delivery method of a certain immunotherapeutic that we deliver to these cells. In another cancer mouse model for melanoma, he actually saw 100% complete response rate, meaning that they were tumor free in these mice with melanoma. When we delivered our drug using our MSQ platform in conjunction with some immune checkpoint inhibitors, these are the clinical standard of care drugs, versus just 14% when you use the clinical standard of care drugs on their own. So we're going from like a 14% rate to a 100% rate. And so that was the real exciting piece of data. And it's that data, as well as the metastatic triple negative breast cancer data, helped us actually secure, or in the process of securing, we're in the final stages of a $3 million Texas-based secret seed grant, that I know that our previous guest of yours, Vincent, had talked about, that organization. So we're really excited about it. And that's from the oncology side. From the brain side and the neurodegenerative disease side, um, how our technology will help in doing is we're trying to target for Huntington's disease. So it's a rare neuro disease. It's genetically driven. Again, these are all the diseases that we're targeting. They lack effective treatments today. They have low survival rates. Um, and so for Huntington's disease specifically, because I've had 6 years of experience targeting the actual region of the brain that affects Huntington's disease, which is the striatum, um, we believe that we can target and deliver these gene therapies that can be used to either treat or slow the progression of the disease in patients, and we could do it safely and non-invasively without having to go through 12 to 18 hours of delicate brain surgery to stick a needle in there and inject these like invasive therapeutics, which is actually what's being tested in the clinic today. So we have a clear value proposition, like compared to those invasive surgeries, by being non-invasive, safe, and relatively within minutes, you could be able to deliver the therapeutic. So
Wow. Yeah, no, wow, that's very, very impressive. I don't even know really how to respond to that. It's funny because I just saw a video. I don't know if you guys know who Cleo Abrams is, but I watched a video from her and she was talking about how Huntington's is now being addressed in a very unique way, and it was really interesting because like I've seen some things on Huntington's and how it's the uncurable disease, and she was saying they're just now finding it. So that's what you're doing.
So we actually, yes. So Unicure, the company, they were the ones who actually did the direct invasive injection and and had some real cool results
Mhm.
for early stage Huntington's disease patient cohort. But that's where they also specified, yeah, but this is after 12 to 18 hours of
Mhm.
delicate brain surgery under a neurosurgeon, to then inject these viruses that can then go in, transduce the areas, and be able to um, do their mode of action, treat the area. So from our end, one, that's actually very good news. You may be thinking like, well, aren't they a competitor? Actually, what they did is they helped prove it out that it is a delivery issue, because when delivered it at the site, they were able to see this, large improvement, significant improvement. So for us, that validates it's a delivery method, a delivery challenge for Huntington's disease. Now the next step is, can we do it where you don't require a neurosurgeon to do it for a full day to go digging in your brain, but instead you can use an ultrasound machine that's outside of your head, outside of your skull, while you're awake, and you're able to do it within minutes, all safely and effectively. So that's what we're trying to do, um, and that's what we're raising our round on for. So yeah,
Amazing.
Yeah. No, I've had such a pleasure knowing you for as long as I have, and you've always been this very much like fix the problem, right? Like, like I know we know so many people who can like identify an issue and then be like, oh, that's a problem. Someone needs to solve it. But like, you're always the person like the forefront of fixing that. And like, I want to segue a bit into my favorite phase of your life. Because I have one, which is like, so you obviously spotted a problem within this student entrepreneurial journey while you were at Rice, right? So you've always been entrepreneurial. You were involved in 2 different nonprofits at the time, Adventure and Nucleate. So, like, tell me a bit about how that happened and how that informed your journey into Music Bio. I know there's a great story there, but, like, let's start with Adventure and let's start with the acquisition of Adventure and formation of Nucleate Texas and how that came about.
yeah, that's a great question. And literally, once I got into Rice and I moved to Houston, I actually, while we were rotating for labs, I think I joined Adventure before. Like I even joined my
What is
lab that I ended up. And Venture is a was a local not Texas nonprofit that was focusing on fostering the life science community here in Texas with branches in Houston and in San Antonio. A lot of it had like a variety of different programs conferring education, experiential learning, and community. At the time I got involved, they had many different things. They still have many different things on offer for like consulting based projects. So if you want to get involved with life science consulting, they have these consulting projects that we do with real life startups and clients to give academic trainees that consulting experience while they're in grad school without having to go take time off and go do an internship or whatnot. They also had at the time what's called the BioVentures Accelerator Program, where it was taking research from the lab and trying to spin it out into a company, um, into a biotech startup, and trying to help them develop their commercialization plan. So while I was, while I was in PhD, I joined the lab with an amazing PI, Dr. Jerzy Zablowski. I call him a unicorn among PIs. Amazing mentor. Probably the biggest reason why I enjoyed, my PhD so much. So that, and also Nucleate and the nonprofit work that I was doing. But I think he made things a whole lot easier and taught me a lot. But as I was going through and building up going up the ranks within venture, I took over the BioVentures Accelerator program in like summer of 2021, around then, and I ran it. I ran it for a whole summer at the time, and one of the biggest success stories at the time was, we ran through a whole summer. We had like four teams, and then one of the teams that won, literally seeing his progression because he was also coming straight from academia, and then he built up, literally his confidence, his pitch deck, everything was just building up, and he was growing with the program literally on a week by week basis. It was amazing to see it like live, and he ended up winning the whole program. And he later on got accepted to the Activate Fellowship up in the Northeast in Boston, which is like a 2 year fellowship that helps you focus on your company building while you're trying to like build up and develop your business, right? So that was validation for me. I will say that at the time, like the resources that we're having locally, like we're really heavily reliant on our local mentor ecosystem, which is amazing. The mentors and experts that we get here from Texas and from especially from the Houston ecosystem. But apparently, there's this other nonprofit, or at the time it was more of a club, being formed out of Boston out of the Harvard Biotech Club called Nucleate. It wasn't called Nucleate, but it was called the Activator at the time. But then they wanted to create a they wanted to create a nonprofit. They called it Nucleate, and they wanted to expand out of Boston. And one of the first areas that they were looking at outside of Boston was Texas. And the first ones they were talking to was the people at Houston who was running this accelerator program called Inventure. And so I got connected to them. We had a very nice brief talk, and literally they were like, "Okay, so we want to merge the Nucleate Activator program with the Adventure BioVentures program. Want to merge, acquire y'all. Like, what do y'all think?" And I'm like, "All right, let's do it." That's it. That's all it took. It was just, "All right, let's do it." Because I can understand and see like the level of resources that they could bring, the expert network they could bring in from the Northeast and the East Coast, and also they're expanding to the West Coast. So I could just think long term of like we can bring a lot of this resources to Texas and also support Texas. And I knew that it was just a start because we started in Houston. Um, and this is me summarizing because there's so many stories we can get into here. But we started off in Houston, then we brought in Dallas into the fold. We did our first year, running the Activator program. Um, when we ran our first year of the Activator program, about like just 6 months prior to that, I had been working with Nucleate a bit on their operations side. And they were like, "You know what, Manny? We think you're crazy enough. How would you like to be the executive in charge of operations for the whole org?" And I'm like, "Sure, all right." Literally, that was the story. Because I was just helping a lot at the time. Oliver Dodd, who's our current executive director, was ascending to co-president level at the time. So he had split the role. He gave me the EVP of operations, and Alex Kim, shout out to him. He became head of the Activator program globally. So as we were expanding, but yeah, we ran Texas first year, success. Houston, Dallas. We then expanded to Austin for the second year. Then San Antonio came in for the third, and now we are technically in our fourth Activator run this year, with going four cities strong. And so that's the crazy part is that time flew by very fast. So yeah, delve into any parts of this.
So, Manny, this is kind of our first. I mean, obviously, other than Music Bio, this is our first, your first dive into business and entrepreneurship and that type of thing, right? So, real quick, explain what the activator is, and then I'll have more questions on how Nucleate and music connected.
That's a great question. So the activator is it's a life science accelerator program, and by life science we mean quite literally like as broad as possible across the health spectrum. We're talking diagnostics, medical devices, digital health, therapeutics, research tools, etc. And really how it goes through these multiple phases. And I'm gonna let Paulomi, to tag in here and like go through the specific phases, because she is the regional director. But I want to just give a summary is that we'll take what we're doing, we're just taking students or academic trainees that have research or ideas with preliminary data in the lab and then helping them develop a commercialization plan and business plan so that way by the end of the program they have a pitch deck ready to go and that they can start pitching to investors. The whole course of the program goes towards you know sourcing the technologies, helping them form teams, securing the mentor expert support, and then culminating in a big pitch event. But does that cover everything, Paloma, or do you want to add on to that?
No, absolutely. I just want to quickly add on, like, Activator was what gave Nucleate its start, but like we have expanded to so many different programmings. We call it Path, which is like a sort of professional development program. We have, I don't even know, Manny, how many volunteers are with Nucleate? 1,500 across the world?
Yes,
Yeah,
yes, we got on.
1,500 people that kind of keep this operation going, with the wonderful support staff of like a couple of full-time employees. But what I want to emphasize in terms of path programming is that we have a lot of like shorter, less commitment involvement for students who don't have their own companies, right? Like me, I'm what you'd consider like a generalist within this world of biotech, right? I could help with grant writing, I help with consulting, market discovery, stuff like that. I just don't have my own company. So like how do you cherish and nurture those adjacent like to entrepreneurs themselves, right? So like we have AI and biotech, we have women's health initiative dinners, like there's so many initiatives that our wonderful like path team maintain and get like and keep going so we can involve like not only the founders themselves but like sort of the adjacent community of students and trainees as well.
And that's one of the things that I love about Nucleate as I've gotten to know y'all. Vincent Pham, who was, I believe, our 10th guest, is
Mhm.
a part of Nucleate. And he was the first person to kind of introduce me to what y'all do. And one of the things we always tell our guests is get involved in an ecosystem somewhere, whether that's you're still in school and your school has an entrepreneurship program, go
Mhm.
there. You might not have an idea for a business, but you might be able to go to a lunch they're doing to learn about how to build a brand or how to file your LLC, simple stuff like that, that
Mhm.
will get you started. And I feel like for the bioscience, especially the academic side of it,
Mhm.
your stereotype is, oh, well, they're the people in the labs and they're doing all this amazing work. And then you get to the business stuff and it's like, what is a balance sheet? What is
Absolutely.
how do you apply for funding, right? And so what Nucleate I feel like does an amazing job of, and man, I'm sure you could speak to this, is bridging the gap between really smart science stuff and business stuff. And you could call it coloring, right? The joke is business majors always color. But uh Manny, how did that kind of play out for you as you're starting with Nucleate and kind of first getting uh, your start into entrepreneurship and then this idea in grad school? I feel like those are kind of how you started your company, correct?
So,
Manny,
uh,
for a second, I'm
so
so sorry to cut you off.
Yeah.
Manny always downplays his involvement with a nucleate, so I'm gonna answer a part of that question for him. Nucleate, like the San Antonio, like San Antonio, were there any of the cities you consider sort of the biotech student-led startup community did not exist, right? Before we are all like the fact that I can talk to you on this podcast and the fact that like I have a title that sounds as fancy as the regional director of blah, you know what I mean? That org structure would not have existed if Manny didn't one day wake up and say, all right, which in hindsight, if you think about like, what you been kind of touching on throughout this podcast about community, right? Go and talk to your entrepreneurial office, stuff like that. For people like me and Manny who've just moved to this country, we don't have anyone. We're always outside the norm. We're always outliers. And what Manny did was he created a space for each one of those outliers and those people to come together and say, hey, I don't belong anywhere else. I'm not a scientist. I'm not a business person. I'm somewhere in between. I'm both and none at the same time. And my role, I don't fit the stereotype of a scientist where I like pipetting all day. And I don't fit the stereotype of an MBA student that I like whatever you said was coloring the lines all day long either. I'm somewhere in between and I'm somewhere hybrid. And he one day woke up and with one word, all right, created this enormous sort of way for us to express ourselves and also develop and grow. And so he always underplays that what he's done for us. And I'm just here to say that on his behalf. But I'm so sorry to cut you off. Please go ahead.
Thank you very much, Paulomi.
Welcome.
I think that's a very good way like to describe it. I think behind the word, there's also like a lot of work and time that went into this. So building this organization, a lot of it was at the very beginning, you're starting from scratch. It's like starting a company too. It was like to say like where I got this experience of like entrepreneurship. Starting a branch here is like starting like a company. You have to find the right people. You have to find the right supporters. You have to find the right funding. You have to get things done. So you have to communicate correctly because at the end of the day, what I learned from this whole experience is that communication is probably the most important skill set to learn here. Uh, being able to communicate really well, not only what you say verbally, but also in writing. And you learn that every day, both as as a startup CEO or as running Nucleate, that you're really just, if you're thinking about it, you're really like a communications lead where you're either setting up meetings to talk with somebody to show, or creating a PowerPoint presentation to show somebody, or to write an email to somebody so you can set up either meetings or try to get something done. Or writing messages. You learn that really communication is probably the biggest thing that you're going to be doing and trying to getting all this done. So how did it end up for us at Nucleate in terms of like bridging the gap and teaching these academics the business side? I like this model of we're academics. We don't have the business experience. We've never started up a company, but who has? All of these mentors and experts and advisors and sponsors who have done it. So what we did is we bring them to the table. We're acting as like the middle managers of bringing them to the table to talk directly to the startup teams going through our program. But as we're doing that, we're also learning at that table. We're sitting at those tables. I'm learning what this advisor from Eli Lilly or Genentech or Johnson and Johnson or whatever tell me about whether it's market strategy or business strategy or scientific de-risking or what have you or regulatory strategy, right? And I'm learning and we're picking this up and we're all sponges here. A lot of folks that are going into, especially in grad school, we like to absorb information. We're used to absorbing large, vast quantities of information. So this is just another day in our lives. Is like we're just listening. We're actively remembering what we're being taught, and we're following up and we're building up our networks and we're able to follow up and then find these kinds of mentors and advisors for our own personal professional development that we can then reach out to for help. And so we've, as Paulomi said, we found this like community of outliers. I like to say for us it's normal to be abnormal. If you're with us, it's normal to be abnormal. It's abnormal if you're normal. So like that's how I like to say it. What it means is that when we're getting folks with us, if you're a PhD student, you're already what we like to consider um in a way abnormal, but more of like very high achieving mindset, very driven. You already like, want to go above and beyond just getting just a bachelor's degree. And you want to keep moving forward. So we already know, like, you know what? But fair. You you're I like to say you're abnormal. But even within them, how do we create a community to help foster them and help them like really feel that they're not just alone in this world, that there's people around you that feel what you feel, that see what you see, that do what you do, and have the same ambitions as you want. And so that's how we brought everybody together. And then we also bring in our mentors and experts to help train these, abnormal folks to also help better express that and to better go into their further careers. And I think that's been the kind of the way we've brought into our company, MUSIQ Bio, where we're really backed by an amazing advisory board. Because at the end of the day, me and my co-founder, we've been academics our whole lives, but and even with my experience of building up, expanding Nucleate's operations from one city in Boston to 60 cities worldwide, um, what we did is we built up an advisory board of people who've done it before, whether it's on the science side or on the regulatory side, clinical side, and even the business side as well. So I think that's one thing that always helps, especially for people who are in college trying to do their own startups. is get the right people behind you that can help mentor you and guide you, who have done it before and who probably made a lot of mistakes along the way and help you to not make those same mistakes. I think that's another big thing too. So I think that's how we've taken it in. And just to also like, put this on a bow of like where Music Bio came out of, it actually came out of my co-founder's lab who was an activator applicant. He went through the program 2 years ago. He applied, went through it. Um, and I saw him develop his commercialization plan throughout the program, and after the program was done, he was like, "Hey, I need somebody more full time in my niche who understands my niche to come and join me." And so he was asking me for like, "Hey, do you know anybody in this niche?" And I'm like, "Well, there's me." And so uh, again, he's doing ultrasound based drug delivery for cancer. I'm doing it for neuro diseases. It was a clear match. And so we've been partners ever since last year, and we've made so much progress since then.
But
So
talk to me
that's
about
like
that serendipitous moment, right, Manny? Like, what are the odds that you find this chapter for Nucleate, Texas, right? And then a few years down the road, Cena's going through the activator program, and you're there. We were all there in Austin watching him at demo day, pitch. And then what are the odds that like his technology is so close to what you're doing in lab and your dissertation as well? Like, what, like, tell me what that feels like when all the dominoes just fall into like this perfect place, and that's so rare for startups to have that kind of aha moment. So, like, talk to me about what that felt like.
I mean, dude, I'll tell y'all right now. Like, who here has before y'all talk to me? Have you heard of using ultrasound before to deliver drugs? Yeah, see, it's not that very common. It's even less common within the bioengineering field.
Yeah.
So it's such a rare niche
Mm.
subject, that the fact that we're able to find it because of Nucleate, because we're able to bring these minds together, I think that's the real crazy part about it that I really enjoy. Because at the end of the day, even though I was an executive of operations, I wasn't looking at myself all high and mighty, thinking, I'm above everybody. No, the genuine best part of Nucleate was the people, was the community. I wanted to be in my role, for the few years that I was there. I was dead set on always being on the front lines, working with every single leader at no matter what rung on the ladder, or where in the hierarchy. I wanted to be able to be front and center with them and help them out and just work with them because they're all amazing. Everybody's doing this awesome science and this cool stuff. I mean, at the end of the day, when we all came into our degrees, we all came because it was cool and we really want to help people. And so when you see these people around and they need help or they need, a little bit of guidance or seeing where stuff is, I'm happy to help and always happy to see that. So I think that's just a one big aspect of, my time at Nuclear that I enjoyed and I'm continuing to enjoy, especially as they graduate and they get their own careers, they're building their own lives. Quite literally today, I was talking with with some buddies who graduated from their PhD program earlier this year, and they're welcoming their newborn into the world. So like just seeing their lives going from like back when they were students, when they were just like boyfriend and girlfriend, to now having families and going and doing careers. You're growing up with these people. And I think that's something that I'm noticing about Nuclear. I'm growing up with a lot of the folks I'm meeting here at Nucleate, and it's just amazing to see. And this is just the beginning. We still got decades to go. We're going to be dominating the biotech scene. That's the crazy part.
Well, Manny, there's a couple of things that I want to kind of unpack and just talk about a little bit more. The first is communication. Um, you really emphasize that as a point of necessity, not only for your business, but just life in general. I think that's one thing that we really, I mean, I know Wes and I have learned that just doing this podcast, but also just we want to emphasize for the people out there because whether you are someone who is, yeah, if you're pitching your startup, like, yeah, you gotta be able to communicate your idea clearly, concisely, and emphasize why they should write you a check for it. But also just in life, clear communication is easier when you send a text to someone and you say it in a clear way or an unclear way that can go two very different directions depending on what's happening. So, what are tips that you have and would give to your college self for clear, concise communication, whether that's in business or just in life in general? And Paulomi, this goes to you too, if you have any thoughts.
Especially as two people who English is not our first language either.
Absolutely.
Yeah. It's a great question, Manny. Why don't you go first?
That's a great question, and especially to my college age self, I think just general tips for communication, especially if you hit the nail on the head. You want to be short. You want to be concise. You want to get to the point. But also, you mentioned also a nice example of you sending a text and you don't know if you can take it one way or another because tone doesn't travel well through text.
Mhm.
Right. And so I think one of the new things that I've been doing is to help ensure that what set that tone, I would like an emoji right next to the end of the sentence to show how the face looks. Like that's I think that helps minimize the tone, or like helps set the tone sometimes. I think another times is again when you're trying to pitch, I think being understanding who your audience is. Um, I think that's a cliche thing. You don't really need to understand your audience, whether they are, for example, if you're talking to investors, you have generalist investors and you have biotech specific investors. And both of them, you can go into the weeds about your about your science, whereas the other one, you need to get into, more general overview and, make sure that you're able to communicate to the heart of it, to them. So you actually do need to understand your audience and know what to say, to help get the point across. Um, and the reason why I harp in on the communication, it is probably the most underrated skill that a lot of people like overlook, and it doesn't become important until you either enter the workforce or you start doing a lot more of like community build or organization building. Like communication is such a key thing for us at Nucleate. How do we communicate to our internal leadership so that we're not overburdening them, so we're not confusing them? You have 1,500 leaders. Back then, we started off with maybe 10. Maybe we had 10 people. To grow to like that scale, you need to really define what your communication is going to be, what platforms, all that stuff, what the infrastructure is going to look like. So you really do need to think a little bit how you say certain things, because if you say certain things, to, let's say, your team, right? Let's say you're leading a team. You say certain things that can either devalue or undervalue your teammates. They might not feel as excited, not feel as motivated to work to do a certain project or certain idea. And so instead, you want to be able to communicate to your team about, hey, this is where the status is. This is the job that we need to do. This is how we're all going to benefit. And I think especially in a volunteer based organization like Nucleate, that's another key thing is how do you get everybody aligned or in range, as we like to say here in Texas, to work together, um, and accord towards a common goal, and being able to not only do that, but balance that with our day lives, our working lives. So again, we're all PhD students. We're all working like crazy hours anyway. So
Right.
we're asking folks to then these are folks that are motivated to spend in an extra hour or two a day, to then do extra stuff, whether it's sending out emails, taking meetings, meeting with stakeholders, etc. So communication is essential to make sure that you're able to motivate your members, to make sure that they're feeling valued, that this is worth their time, and that they are gaining something, they're developing professionally, and that that doesn't seem like they are, you know, that they could feel like they're actually enjoying that they're, as I like to say, having some fun and getting things done. So that's the gist of it. Yeah.
Yeah, no, totally. Um, Communication is such a great topic, though. It really is.
Yeah.
Uh, I mean, for myself, it's been a huge journey. I mean, in starting this podcast, like I've told Turner I mean, like I wanted to start the podcast because I was interested in developing production skills and whatnot, and I was just getting back into the entrepreneurial space because I did a little bit when in my freshman year, but then I dropped off, and I'm starting to come back into it now, and I'm just loving it. But that's besides the point. Um, I've learned a lot about communication in just doing this podcast, and even now in one of my classes, or like one of the big things that they emphasized as like the downfall of a team is when everybody thinks that they agree, but they don't actually. And it's like,
Yes.
yeah, that's a huge issue is if you don't communicate and don't realize that. And so that aside, I think that we have talked a lot about your business and the technologies that are involved in it, but I don't know if we've been super clear about the distinction between your research in the ultrasound technology and what exactly your company does. I mean, I think we've talked about it, but I just want to make sure it's super clear for our listeners what that is. We want
Yes.
to be communicating right.
Absolutely, absolutely. Uh, and again, from what my research was, I was using these unmodified microbubbles and these engineered viruses, turning them into taxis, and I was using that to deliver these engineered viruses to your
Mhm.
brain
Yes.
for brain delivery purposes. My company, we're ditching the viruses and we're focusing only on the bubble, and we're engineering the microbubble itself to be able to carry the drug on it and target specific areas of your body. And so
Gotcha.
that's really the big difference here.
Hmm.
And what
Sweet.
and what's your business model? So obviously you're developing this technology. You're searching funding for, I'm certain, completing more research, maybe beginning clinical studies and finding some way to get this actually to market. But is this going to be something that is sold to drug companies to attach their drug to your bubble? How does that work?
So we have initial indications that we're targeting with drugs that we're loading on, based on what we've from like commercially available drugs being able to deliver. Um, I think the other aspect of our platform is that it's versatile enough that we can load in different drugs from other pharmaceutical companies or use different antibodies to target different cell types, and that we can have like a partnership play here where we can partner with different pharmaceutical companies, take their drugs that, let's say, they're either too toxic to be delivered on their own or even too ineffective to be delivered on their own due to different challenges they have in getting to the right places in the body. We can stick them on to our microbubble platform and be able to do the experiments to deliver them and improve their efficacy and safety. So that's really the one of the that's more of like our short term, medium term play in order to be able to get revenue for this company. Keep in mind that again, with course with respect to therapies and pharmaceutical companies, there is a clinical development pipeline. So that means that throughout the whole process, going through the FDA and going through the clinical trials, we're talking like 6, 7, 8 years, if not more, trying to just to get to a clinical product ready to go for patients, and that's when you can start making the revenue from there. But in the meantime, if for companies like ours, so who are trying to make revenue, or if they want to make, if they're able to do so, they would do partnerships with these large pharmaceutical companies. They'll bring in with some upfront cash and then milestone driven payments based on you delivering on those milestones. And so a lot of times those partnerships actually end up into acquisitions. So a lot of companies will do like an early stage partnership with a big pharma company. They'll pay like tens of millions of dollars, if not more than that. And then after accomplishing all of the milestones, they might reach a point where just the big pharma company feels like, you know what, we want to acquire you, and so they put in a big offer and acquire the company. For this big pharma companies, this process is probably more resource efficient than them having to do this entire process on their own.
Mhm.
Like there's this, some people like have thought that there's this fear that big pharma will steal your ideas or your technology and do it themselves. We've talked to some pharma companies, and one of the best responses I heard was from this pharma exec. We have 30,000 scientists thinking up of great ideas every day. Why is your idea, better than what we're thinking in there? Plus, another thing I've noticed from being able to work with pharma, large pharma, they have to go through the rungs. They have to go through this hierarchy and bureaucracy just to get approval. By the time they get approved to even start looking into this technology, our smaller startup, which is only made of two full-time employees and like a gaggle of advisors and consultants, will have already made the progress that they would have done in like in like 2 years, that they would take 2 years to do or something. So that's flexibility and that speed and efficiency of execution is what makes it much more efficient for these big pharma companies to partner with these smaller scale startups to let them develop it on their own and just give them the money to run fast with it.
No,
So
I wanted
that's where the benefit comes in. Go ahead, Paulomi.
I was gonna say I wanted to combine kind of few of the topics that we've touched on in the past couple minutes, like one being communication, one being sort of dissertation versus like, what your startup is. So obviously you met Sina through Nucleate. You kind of had known him for a while before you started working together. Like there are so many different like sort of these turning points that come about in the lifespan of a startup, right? Like a successful or an unsuccessful one. Whether to like take this person's investment, are they a good fit for us or not? Like, and I know you have clearly delineated roles between you and your co-founder, but like, talk to me a bit about what that each of those turning points look like within the setup of your company. And let's say 5 years down the road, someone comes knocking at your door and say, "Hey, here's a check," and Cena says no, and you say yes. What happens? Like, what? Like, you know what I mean? Like, can you talk to me about like what that relationship building is like in addition to the technology building and also sort of the key inflection points within the lifespan of a startup like yours? Like because you don't have a service, right? You're not selling scrub daddies or something like that. Like your exit is your exit, and you're building everything towards like that one exit. So can you talk to me about a bit about that?
Yeah, and I think that goes to the core of any startup. It's about the team. It's really the team is the core. Like, can the team execute? There's a lot of good science out there, a lot of it that's patented, that looks amazing. You could be like a life-saving cure, but if there's no one to execute on it, it's just gonna stay on the shelf. Or like I like to say, it's gonna stay on ink. It's gonna be ink on a paper and not incorporated. So that's a lot of big things from our end is we need to be aligned on the principles that we work on. The strategy of the company, how we'll split up the roles. In the very early stages, it's really all hands on deck for both of us. Both of us, have the science background. Both of us are talking to, are reaching out to investors, to partners, to mentors and experts and advisors. So it's all hands on deck. It's really once the capital comes in and we start to be able to execute that role start like more being like split up because now we're now ready to execute. Each of one of us has our roles and defined and ready to move. We already know who we're going to be talking to, what we're going to be doing, and it's just that implicit trust. Like we've worked and we've talked and we've built up this relationship through actually just delivering. Like we, a lot of people say like you want to find somebody that's building a team like family. I disagree. I'd rather build a team full stop because a family can accept you missing a milestone or like let's say that a family's trying to hold you accountable for a diet. They'll be like, yeah, it's okay, you can have that piece of cake, whereas a team will be like, you better not. You got to stick to your plan and lose those extra pounds, so they hold you accountable and make you responsible and allow you to really make sure that you're doing what's best for the whole company as an entity. Because at the end of the day, especially with me and my co-founder, right now it's just the both of us, right? But as we grow, we're going to be bringing on more full-time employees. We're going to be bringing on many more to come on. Now, you're like from my end as CEO, my thought process is I got to keep money flowing in so that way the company doesn't go under, and these people who are working as full-time employees who are bringing in their paychecks to feed their families, don't have to be worried about that. So my job moving forward, once we bring in the capital and we're executing, is to make sure that the company keeps running, right? And so that's how we've kind of had this implicit trust and communication. Like we have these hard conversations now when it's just monopoly money, so that way we don't have these kinds of like very hard sticking points when the real money comes in. So having these early, especially, is important. And I think that's really the crux of it. It's just you got to believe in your co-founder in the same way they got to believe in you.
I found it funny that you said you don't want to treat your team like family, and like in the internship application process, which was me this last May, I guess, or well, before then, really, um, was something they said was if you see that phrase, "We treat you like family," in their description, is like, no, run the other way. Um, but it was kind of funny, and I think that also plays into a little bit of the communication talk as well. But because like it's unclear boundaries if everyone's treated like family and whatnot. But um, to transition into what I was going to ask, um, you were talking about how everything is focused towards the exit, getting acquired, or I mean, if that is that wrong, or
It's like one of the opportunities, like,
it's one of the opportunities.
because, as a startup, you have to be flexible and like thinking like,
Mhm.
you get investors, they want a return. And a lot of options to get that return is they'll either do like an exit via like a merger acquisition or like an IPO where you become a public company. And so you have to think about these different kinds of exit scenarios as a startup founder too, especially because that's what's on the mind of your investors. Uh,
Yeah.
Ideally, my personal thing, I want to see that drug get into patients. That's
Mhm.
my important thing. Like I want
Yeah.
to get the drug all the way through and see it get into patients, because that's the dream, to create something that's never been done before and that's helping people's lives. So
Mhm. Yeah, and that was effectively my question is like what you saw the future of music bio being, and like where you see it going.
oh yeah, we're trying to be the leader in drug delivery. We're introducing quite literally a new way to get drugs into your body that's not invasive, that's safer, that's more effective, and can do things in literal minutes rather than several hours. Where you don't need a neurosurgeon or just anyone like digging with a knife into your skin. It, you can just use like an ultrasound scanner at the skin at your skin, um, and that can deliver the drugs exactly where they need to be. That's how I envision. And that's the neat part of our platform, is that it integrates well with already what hospital systems have. And
Mhm,
that's a thing too about whenever you're doing a startup. Look at what if you're trying to go into an industry or go into somewhere that already has a set infrastructure in play. What helps de-risk things and allows for easier adoption and entry is look at how you can integrate into that existing infrastructure. Look how you can integrate into that existing set of equipment and utilize what's there, because it might take longer for a hospital to change which equipment they get or change the processes than you just being integrated in with them already. So for our site case, there's all these hospitals have ultrasound scanners. They all have the ultrasound scanners that are used, at the bedside. And then there's more hospitals getting more of these ultrasound scanners meant for blood-brain barrier opening. So we're just taking advantage of this wave of, all these hospitals have these ultrasound scanners, and we're just going to use what's already out there.
mhm.
So our end, we just have to test each and every scanner that we want that we want to use, and just show that to the FDA that this works with this scanner. So
Yeah.
Totally,
And
like
how do you think and how do you think the technology is gonna change in the next couple years?
I think a big thing about it is, and this is the big buzzword, is just how AI integrates into everything what we do. I think it's really more about like what do you feed the machine learning or AI systems, like what kind of inputs you got to feed. You got to feed it like pretty clean inputs so that way it gives you the responses that you want it to get. I think from our end, in terms of the bio side or medical side, I think a lot of it is going to be more on the diagnostics that I see pushing more, because you could have this uh, the system that you just plug in all these images of MRI images or CAT scans, and it can be able to detect, for example, if there's any anomalies much quicker than maybe than any other surgeon or or radiologist. So I think that's probably where the biggest um, change that I personally see going, because mostly that would you and that goes back to my earlier thing. How can you integrate that into current existing infrastructure of a hospital? And so if it just means that you just plug in a literally literally download a software app on your computer and you just load it files, that's so much more easier
Mhm.
than having to create like a whole new brand machine that you have to buy and insert it there, and that has to be connected to your MRI machine, right? So like I believe is the biggest change is integrating that, and it's going to be more on the software side of what you can download to the existing infrastructure and hospital systems.
Manny, why don't you just clarify one point that we were talking about earlier? Like, I think it's really important for our listeners to understand like different aspects of like or different types of companies within life sciences, right? Diagnostics, therapeutics, drug delivery. And so like we were touching a bit about like what does a successful startup look like or what is the end goal, right? And as Wes mentioned, is your goal to have a big exit and like, and be acquired. So like as I was kind of alluding to the fact that like you're not like you don't necessarily have a revenue based model at the moment because you don't have a product that you can go to hospitals and say, hey, it's going to cost you $200 a kit to buy this from me, and I'm going to manufacture the kit and sell it to you myself. Like, why don't you explain to our listeners what those differences look like, and as you go and mature as a startup, like what and how those options that you were talking about, like M&A or mergers and acquisitions or IPO, like how are they different within these different formats of companies, like for a diagnostic device versus for a drug delivery like you?
And I think I mentioned like how like for therapeutics and like, traditional classic biotech, it's long timelines. The way you can shorten those timelines is if you go for drug or diseases that benefit from like fast track or accelerated approval by the FDA, meaning that they'll cut it down by a few years of how much you need to prove that this works in this kind of disease space. But if you're talking like diagnostics or medical device, especially medical device, it's a much shorter time span. We're talking, like, you know, three to within 2 to 5 years. We're talking, the time span for a medical device to start being used in humans, to start being sold, and so that's a different kind of like business model that you have to think about. For a therapeutic side, when you start thinking about the customer and selling, you also really a lot of times you're thinking about reimbursement. So you have to get like reimbursement codes. You have to talk with payer providers, and then you have to then advertise to the physicians who can then advertise to patients. You then see those pharma commercials that you see on TV, advertising a drug. It gets funnier and funnier every time I check them out. They change so much, but you then see like they're advertising to have their patients ask their physician about it, and so there's a whole communication process behind it. But for med devices, no, it's different. For med devices, now you're talking about a very shorter time frame, and again, it's now you're much more urgent to talk to your consumers, talk to your people that will be able to sell it to, whether it be patients or it could be these large medical device manufacturers or providers or distributors, right? Because then they could put it as part of their offerings on their website, and that you can sell it through that. Um, so I think the biggest difference in the business model is that you are going to have to work with your patients and your physicians a lot sooner if you're doing medical devices, for sure, than you would with therapeutics. I think with digital health applications, it's a lot more service based that I'm seeing right now. So if you're trying to monitor your health, for example, or do whatever the crazy amount of things that go on right now, but if you're trying to do that, you then start to do a service or subscription as a service model, trying to help with folks monitoring their health. So that's a different business. It's like a completely different business model, and that's all within life science too. That we accept into the activator at Nucleate. But then you all of these different things require a different set of experts, different set of mentors, different set of mindsets that you'd go in and strategies. And the best way to go through it is to find the right mentors and experts and advisors. Find the right people that are that know how to do whichever process or whichever field that you're in. And you have to go even deeper and deeper. Like, can you find the sub niche of that subfield of biology that can help you on that specific thing? That would be the best case scenario. So that's I think just like the general difference is you could go from like selling it straight to customers or like to patients, sorry, selling it straight to physicians. For therapeutics, a lot of times you might be selling to the pharmaceutical company. That could be your primary customer, because that pharmaceutical company will acquire you, buy you out, and then further develop it and then sell it to patients or give it to patients. So for us, like from therapeutic side, your potential customer can be therapeutics companies.
One thing that I just love hearing all of the stories of all of our guests is the variety of experience and skills that you all have. To your point, even within the life sciences, you can have diagnostics, therapeutics, all these different types, and then you have to, like you said, go into those niches and find the right people. Our guest last week, he has an amazing company in Auburn, Alabama. It's a moving company, and he was able to bootstrap it. He started just using his own truck and his grandfather's trailer, built it up, and now he has hundreds of movers, and they're in multiple states and doing amazing things. This is very different, right? This is a larger. You're not going to see any reward in the first couple of years because you're building. You have to get large funding, and then you sell out to a large company or IPO, or it's on a much different scale. But all the same things of communication, working well with your team, all go hand in hand. So if you can give, kind of just wrapping this up, one piece of advice to your freshman year self, whether that's in undergrad or maybe even you could say for grad school, if you had to give one piece of advice on how to be a better person, entrepreneur, anything, what would it be?
Damn, I gotta think a little bit on this one. So I'll do it when I was a freshman at community college, because I think because that happened to be, what are we, October 14th, so roughly around 11 years ago. What would I
Wow.
tell myself 11 years ago? Um, you know, that's like the I think here's to give you just some context. Told myself that in the next 10 years, I'll probably finish my PhD and be a startup CEO, and it happened. Literally on the day I was named CEO by Asina on October 6th of 2024 last year. So and it was just by coincidence. So to say like to myself is just probably, but like you're gonna get those dreams, but you're not gonna know how, but you're gonna get there. You don't know how, but you're gonna get there, and you just gotta buckle up, keep grinding, keep working, and just keep moving forward. Keep staying focused. You gotta stay focused on this. Just keep, thinking that what's the next step? What's the next thing? You just keep hitting. Just keep it moving forward. Don't stop. Just stay focused. Keep it going. Keep the drive moving, because again, you have this idea of this goal that you want to get there. You will not know how. because there's going to be so many twists and turns that come in. There's going to be so many valleys and peaks that come through. Like it's, there was no way I would have anticipated that I would have, gone to here or done this or done the Nucleate was not even a thing. It did not even exist at the time when I was a freshman, right? Like this whole concepts that we're doing, everything that we're doing here, you don't know that it was going to come in, but eventually it will. And so all you got to do is just stay focused, be on the lookout for the opportunities. Um, I think when I was a young freshman, I was like a kid in a candy store coming to America, dude. All these opportunities around, I want to eat them all. So I was going for every single opportunity that I could get. I would say maybe the only thing that I would tell myself is choose which opportunities wisely, because you could get definitely like too many opportunities. You can overstretch, not overstretch yourself, but then you won't have time to really focus in and do well on the opportunities you've selected. Um, so I think that's probably around what I would recommend my younger self, but I'd say, yeah, buckle up. Buckle up. It's gonna get wild, but you'll get there.
Yeah,
And
that's
what would be the one question that you wanna ask? It's the next, sort of the startup founder in this series, because 'cause we're gonna have 4 more as part of the Nucleate or Nucleate alumni, and you don't know who they are, but what's, like, something that you're etching to know from another founder?
Give me a recommendation of a food spot that's really good. Like, you gotta give me some real good food. You gotta tell me the city. You gotta give me a real good recommendation because, I tell people this, the best part of being part of Nuclear, where it's 60 plus cities worldwide, it means
Mhm.
that no matter which city I go to, I know somebody there that knows where the best food is at. So that means I not only know their ecosystem well enough that they know where the best food is at, but they also know who the best biotech people to talk to and etc. But they know it so well that they can give me a good hint on where the best tacos are at or the best, stews or pizza or whatever. So yeah, that's what I'm asking the next one. What's your best what's a good restaurant that you can recommend? And give me the city.
Well, Manny, Paulomi, thank you very much. This was a blast. You've got great stories with Nucleate. Manny, you got some great advice. We're really looking forward to the rest of the series. Before we leave, Paulomi, why don't you plug Nucleate? Where can we find y'all? Where can people learn about what y'all do, get involved?
Absolutely. I will, just put myself out there, like, connect with me on LinkedIn. That's where I'm the most active. Nucleate Texas has a LinkedIn page. Please follow us. If you go on the Nucleate website, we also have a newsletter. You can sign up for that. And also, Manny, his full name is on there as well. Feel free to connect with him on LinkedIn as well. Like, we love to talk to people and kind of help out. And just because we're in life science doesn't mean that we don't want to get to know you and learn from you, and also like just build this community into a bigger, more sustainable space. So yeah, just ask us for coffee, ask us for dinner, like, or even a Zoom meeting. Happy to chat. Yeah,
Awesome. Thank you both very much for coming on, and hope everyone enjoyed.
Yeah, that's a wrap.
That's a wrap.
Thank you, Turner and Wes. Y'all awesome.